There are many risk factors that can contribute to potential child abuse and neglect. Some of these factors include young maternal age, marital status, and poverty or neighborhoods with high crime rates, or limited resources. In New Mexico, teen pregnancy is a major issue. Potential child abuse and neglect can happen in both single-parent homes or married homes. Poverty is, and neighborhoods involving incidents of violence are major risk factors that can also have drug-related problems as well. More risk factors include parents' difficulty in anger management and control, limited parental support, or isolation. Also, parental drug and alcohol abuse, mental health disorders, or cognitive impairments. Child abuse is more likely to occur when parents have a short temper, often tend to take it out on children. Drug and alcohol abuse is a large risk factor that plays a role in child abuse and neglect. Mental health disorders and cognitive impairments are also large risk factors. There are many programs to support the prevention of child abuse. First, I will mention the universal programs that include services provided to a majority of populations such as early intervention services, home visiting programs, Head Start programs, and public school programs. Targeted and secondary programs are services that bring in specific people or communities such as after-school programs, teen pregnancy or parenting groups, counseling groups for drug and alcohol abuse, parent groups for children with disabilities. Some local programs here in Las Cruces include La Clínica de Familia, Jardín de los Niños, for example. How do home visiting programs support child abuse? Home visiting programs help support parental understanding of developmental expectations for their child, parenting strategies, and discipline. Also, home visiting provides modeling for development, play and interactions. Home visiting provides information and support for parental stress and family dynamics. Support is crucial to helping the families that are in need and help them know that they are not alone. Early intervention programs provide initial screenings and evaluations to determine developmental delays and identification of environmental risks. Children meeting eligibility for early intervention services may receive services including therapy to support specific areas of needs, parenting education, and help assessing available community resources. Head Start programs and public school supports. Early Head Start programs provide families with support for children's medical, mental health, developmental, and educational needs, and access to other community resources as needed. Public school programs help connect families with programs to support children's educational needs or networking with available community resources. Programs supporting young parents. Programs in Las Cruces that support teen pregnancy and parenting include Turning Point, GRADS program in the Las Cruces Public Schools, Camino Home Visiting, Families First Home Visiting, and early intervention programs including Aprendamos, MECA, and Tresco Talks. These programs and services help provide education, guidance for accessing available resources, and parenting strategies. In addition, many of these programs value children and families. Also, they have staff specifically trained in infant mental health and child advocacy. Community awareness to support child abuse prevention. In addition to helping parents, education for community partners, networking with children is essential. Agencies working with children, physicians, daycare providers, and educators should be trained on risk factors, child behaviors, and other potential signs of child abuse and neglect. Mandated reporting of potential child abuse and neglect. Any provider working with children within a daycare setting, school, home visiting, early intervention, or medical setting is mandated to report concerns or signs of possible child abuse or neglect. Even if you are not in any of these settings, but possibly see signs of abuse or neglect, please call Pound Safe or 911. Specialized treatment for children that have been abused include cognitive behavioral therapy, play therapy, expressive therapy, and music therapy. Cognitive behavioral therapy helps treat problems and is also known as CBT. This helps boost happiness by modifying dysfunctional emotional behaviors and thoughts. CBT focuses on finding solutions and encouraging patients to change destructive behaviors and patterns. Play therapy is used by therapists to help children express what is going on or what event happened through a nonverbal way or sometimes verbal by using toys and children's language. Expressive therapy, also referred to as expressive arts therapy or creative arts, is used as a form of therapy through creative arts to help express what problem or worries may be occurring. Music therapy is specific use of music created by professionals who developed individualized treatment and support groups for people of all ages to express social, emotional, communication, sensory, cognitive, and spiritual needs. Supports to improve prevention of child abuse. Helping the family to find resources that meet their specific needs and that support their cultural and family dynamics. Helping the family develop a clear understanding of their child's needs and areas of strength to support attachment and social, emotional competence. Supports to improve prevention of child abuse. Provide referrals for families at the earliest sign of need, including when a mother discovers she is pregnant, to access available programs. Agencies can support their staff by developing an understanding of risk factors, signs of abuse, and parenting issues, contributing to potential abuse such as frustration with their child. Reflective supervision is necessary. It helps support staff, provides a way of helping staff members to deal with the stress of providing services for families. And it is very important that the providers of these services do self-care practices in order to provide efficient and effective services to families and children who may be going through child abuse, neglect, or are at risk for child abuse and neglect. This concludes my PowerPoint. Thank you.